All right, so guys, here is just like an introduction to what aromatase inhibitor drugs. So what is happening is um okay, this aromatase is actually an enzyme that if it is in the body, it will serve to converting androgen into estrogen. You get. So for the if I are saying there's an aromatase inhibitor drug, that's basically a drug that is preventing this enzyme from being able to convert androgen into estrogen. You get. So we have examples of this drug, and this is just an example. All right. So each of the drugs, we actually took our time to talk about its pharmacology. Okay. So if you want to know the pharmacology of any of these drugs, you simply let me know. Okay. So this is it. They act here so that they inhibit this enzyme that usually converts what androgen into estrogen. Okay, thereby they will reduce the levels of what estrogens in the body. Okay, so that this aromatase is the enzyme that catalyzes the final steps in the production of what estrogens from androgenic precursors within the ovary and even in peripheral tissues. So aromatase inhibitors are actually a class of oral estrogenic synthesis inhibitors. If you are blocking this enzyme, then estrogen will not be synthesized. So this Exemestane usually sold under the brand name of Aromasin. If you see it in the market, it's usually sold under Aromasin. It's a steroidal and irreversible aromatase inhibitor. It is approved for its use in the treatment of breast cancer. Then we have the testolactone. It's another irreversible aromatase inhibitor. For major adverse effects of these drugs include things like hot flashes, fatigue, CNS effects such as insomnia, depression, and anxiety. Okay, each of the drugs we'll be talking about is pharmacology. Then anastrozole and letrozole are what non-steroidal competitive inhibitors of aromatase. These drugs are used as first or second line agents in the treatment of breast cancer because for breast cancer, there are some one or two breast cancer type of cells that they usually grow more if there's high presence of estrogen. So if you are now bringing drugs that will block an enzyme that is important in the production of estrogen, it will reduce it. Okay. So adverse effects of these non-steroidal ones include things like hot flashes, vaginal bleeding, insomnia, bone pain, and GI disturbances. Okay. So I think that's it for an introduction to aromatase inhibitor drugs or therapy.